EPPE, the effective provision of preschool education, is the largest study in Europe of the impact of preschool. And it's also the most expensive piece of research that the English government commissioned. I'm going to talk about some of the key messages that research has been able to give in order to make a difference to policy. Because our study was very much about a policy, how policy decisions are made. I'm going to talk about some of the key findings. I'm going to talk a little bit about quality, and we've heard lots about that today. And I'm going to talk about how we looked at effective pedagogy. Okay, a little bit about what England was like in the early 1990s before the research was commissioned. We had a very big focus on standards. Were our standards for children at 16 good enough? Were our standards for children at aged 11 good enough? Were our standards for children at 7 good enough? And we had the first international comparison tables of outcomes of studies, and we were shocked. Finland was up there. Good old Finland. Good job they can't play football. So we looked at and we thought, what are all these preschools doing in order to foster good dispositions to learning for children when they come into school in the English system at 5? Because we start schooling in England at 5. So we had a focus on standards. We had the beginnings of curriculum guidance. And in England we have a national curriculum which all of our schools have to follow. But in the early 1990s we had the start of a curriculum for young children. We had a range of different providers, some provided by the state, maintained settings, some private settings, some run by church groups, a whole range of different people providing preschool education. We had very little regulation, not much inspection, some accountability, but not a lot. And we had a very poor framework for qualifications. You could literally walk into a preschool without any qualifications whatsoever and work with young children. But we did have a government who came in 1997 who were very, very keen on using research evidence to inform policy change, and who are also interested in moving children out of poverty and focusing on helping those who are most disadvantaged. So, they looked around for research evidence on early years. And in England, there was very little research evidence. Most of the evidence on longitudinal studies was from the American Peri-High Scope project. And that suggested that children who'd been in preschool tended to have better high school grades. They were more likely to earn more. They were more likely to own their own house. This is at age 27. They were less likely to be involved with the police and less likely to be on social benefit. But this research suggested that preschool was good, but in England we had no idea whether our preschool gave these kinds of results or what kinds of preschool experience would lead to these results. So the EPPE study was commissioned to compare the progress of children from a wide range of different backgrounds who had different kinds of preschool experience. Rich children, poor children, black children, white children. Children living in beautiful leafy houses, children living up on the top of a tower block. We wanted to see a wide range of children. We also were asked to separate out the effects of preschool between age 3 and age 5, and the effects of primary school between the ages of 5 and 7. We wanted to know if you go to a really, really good preschool, then you go on to a really dreadful primary school. What does it do to your learning? Is there something about good quality preschool that helps you overcome poorer experiences in primary school? We wanted to know whether some preschools were better than others at really giving children a lift to their learning. And if they did, what did these preschools do day in, day out that actually made a difference to children's outcomes? So, how did we do it? Okay, what we did was we selected 6 regions across England, which, if you put together, made a nationally representative sample. So we had rural county, we had inner city county, we had a rich suburban county, we had a northern county. Together they made a representative sample of England. We then selected 141 preschools, and our types of preschools, I won't go into all of these, but we had nursery classes, which is state provision, playgroups, which are community organised, private day nurseries, which are for profit. They're private firms made for profit, run for profit. Nursery schools, which again are state provided. Local authority daycare, which is like a social services for very disadvantaged children. And then our latest and newest provision in the 1970s, which were centres that combined education and care and working with families and health support and community work. And we call these our integrated or combined settings. And they've since become known as our children's centres. So we had 2,800 children in these settings, and then we had another 300 children who had no preschool experience. And what we did was we assessed the children at age 3 when they came into preschool. We assessed them again at 5 when they left preschool, and then all the way through their education at different time points, we've looked at their progress. We've looked at their progress in terms of their cognitive or intellectual development, but we've also looked at their social behavioural development. And for us, it's important that we look at both the intellectual but also the social development. So, a little bit about our data. We have child assessments at lots of different time points. We've got extensive interviews with all of our families, one-to-one interviews, followed up by questionnaire with all 3,000 children. We know an awful lot about these children. We know mothers' qualifications, we know the income, we know how well our child gets on with their siblings, we know the family composition, we know any development problems, we know a vast amount through these very detailed interviews. We've got interviews and questionnaires with staff. We've got the Eficaz quality rating scales. We've got case studies of effective preschools, and we've got lots of other measures taken as the children move through schools. So we've got a huge amount of data on these 3,000 children. A little bit about the assessments, so that we're all clear. By assessments, I don't mean that we tested children. The assessments at 3 were done through our researchers going in and playing games with the children. And then we have a set of assessments based on games that the researchers are able to then assess children on their verbal reasoning, spatial awareness, and their naming vocabulary and naming comprehension. So all of our assessments were not children sitting down doing tests. They were all developmentally appropriate. At age 5, we repeated these measures, and we looked at early number skills, pre-reading skills, and then at age 6, we had some assessments of their reading and maths, and at 7, we have our first national assessments. All of our children in England at age 7 have a national assessment. And then we've carried on looking at those children's progress. We also have, at all of those time points, information on children's poverty status, special needs, and we have questionnaires to the children themselves that they tell us about their experiences at school and at home. And we also have these assessments of their social behavioural development. Okay, so what do? Here's the methodological bit. Like your team, we develop multi-level models to try and explain the progress our children make. So we see children nested in centres, nested in communities. I wonder if I might use you for a moment. Perhaps Robert, if you'd stand there for me, and perhaps Sharon. Perhaps Sharon, you'd stand there for me.
Yes.
Yeah. So we've got these. We've got these 2 children. No, this is wrong. Right. We've got these 2 children. Let's imagine this is a black boy. His father's a doctor. His mother's a lawyer. He lives in a rich house. He goes to a private day nursery. We've got this white girl. She doesn't know who her father was. Neither does her mother, because he wasn't around very long. Her mother had her when she was 16 years old. She's got 5 brothers and sisters. She lives in the top of a very bad tenement. She goes to a playgroup. How can I compare these two children? Well, what we do, the multi-level model, makes statistical models for each of these children. We can statistically account for the fact this is a black boy, so there's a statistical effect of his ethnicity, there's a statistical effect of his gender. We can account for the fact you've not got professional parents and you have. We continue to make statistical models for all of our children so that we can then manage to get a level playing field between these children. We can then look at the statistical power of the background factors and the preschools they went to. Does that help to, are you with me? Does that help explain how we can look at the impact? Thank you, Sharon. Thank you, Robert. Okay, so we looked at child level, but we also had one other little thing we looked at in the EPPE study. We thought maybe before our children came into preschool, they might just have learned something from home. So we also had some measure from interviewing the parents about the quality of their home learning environment. So when we look at the impact of preschool, we can look at child factors, being a boy, being a girl. We can look at family factors, professional parents, number of siblings. We can look at the home learning environment. We can look at the impact of preschool and the impact of primary school. And we can look at the strengths of each of these separately, or we can look at them in combinations. And we look at them, how they affect children's cognitive and their social behavioural development. I'd like to give you now just some information about the kinds of policy questions we were asked, how we answered those policy questions, and then the kind of policy development that then happened in the light of that. Our first policy question: who benefits from preschool education? And EPPE was able to say all children benefit. It's not just something that's for disadvantaged children to help them catch up. And if you want to raise the level of a whole nation, then all children have to benefit. So all children might have preschool education, and you might have some particular programs for different groups of children, but it's good for everybody. And the policy development is that in England, we now have free preschool education for all children between the ages of 3 and 4 if their parents want it. And for us, that's a massive financial investment. The second question: what age should children go to preschool? And how long should they go? And this was a concern because we had a lot of people who said, well, no, very young children should always be at home. And what we showed was actually there's a duration effect of preschool. So, for instance, if you've got a bad chest, yeah, and you go to your doctor, yeah, and he gives you antibiotics, Does he say, go home tonight, drink it all, and tomorrow you'll be better? No. He says, take a little bit today, a little bit tomorrow, a little bit the next day, a little bit the day after, and after a while you'll feel better. And preschool's a little bit like that. Children need to have little bits over a longer period in order to have those benefits. And there were some slight disbenefits for very young children in preschool for very long hours. So our policy development was that all children have free preschool education for half a day a week, for 2 years. And also we've increased the money we give to parents in the first year of their child's birth. So if you want to stay at home with your baby, then we give incentives, money, to encourage some families to stay at home. We also found that there's very positive benefits for disadvantaged children if they start younger. So we have a longer period of time for our very poor children. Because for many of them, it's better to be in a good quality preschool than to be in a very, very poor home. Okay, the next question. What kinds of preschool give the best outcomes for children? And our research showed those preschools that combine education, care, health, family support, and working with parents had the best outcomes. And we've had now almost 2,000 new, nearly 3,000 children's centres developed across the country to work not just with young children, but to work with their families as well. And we found that those are the best outcomes for children. Not seeing children just needing care or education, but that children need care and education, and that has to be embedded within their family. And preschools, which had some of the best outcomes, worked very strongly with our communities, with families. Okay, the last policy question was, what kind of workforce do we need in early years? And the EPPE study was able to show that there's a direct relationship, statistically, between the quality of the preschool and the qualifications of the staff. And it was a very linear relationship. Every time the qualifications went up, the measured quality improved. And we could test that. We could measure it. So the policy development is that in the last 15 years, we've actually invested a very great deal of money in providing a proper training framework for people who want to work with young children. I think it's no coincidence that the Finns, who have the highest outcomes on the international comparisons, all of Finnish preschool workers have a master's level qualification. We're a long way behind that in England. But what we have started to do is to say, if you work with young children, you have to take your professional development seriously, and we have a framework which will help you improve your qualifications. Okay, that's the second part of my presentation on some of the key findings. Are you still with me? Okay. Those are just tiny number of key findings. We've been going 13 years. We've got lots of findings about preschool and primary school, but this just shows some of the importance of good research findings to help policymakers answer questions and then to translate those policy discussions into actual policy development.